My name is Emma Beisheim, and I'm a PhD candidate under Dr. Megan Sions, who received an ACCEL pilot grant to evaluate sensory changes following lower limb loss. The work I'm presenting today on behalf of our research team is titled Generalized Pain Hypersensitivity in Post-Amputation Pain and will be included in my dissertation. Over 50% of adults with lower limb loss experience persistent post-amputation pain, including phantom limb pain or pain perceived as coming from the amputated portion of the limb, and residual limb pain or pain in the remaining portion of the limb. Persistent post-amputation pain may reflect central nervous system hypersensitivity, which can be clinically assessed by evaluating hypersensitivity to pressure-induced pain. However, pain hypersensitivity remains understudied among adults with limb loss. As females typically demonstrate increased sensitivity to experimental pain, our goal was to compare the extent and patterns of pain hypersensitivity between adults with persistent post-amputation pain and pain-free peers with limb loss while considering potential influences of sex. 134 participants, of whom 95 had a unilateral below-knee amputation and 39 were pain-free controls with intact limbs, underwent pain pressure threshold testing, as can be seen in Figure 1. Trained examiners used an algometer to gradually increase pressure at 10 anatomical sites, seen in Figure 2, until participants first experience pain. This point is defined as the pain pressure threshold, where reduced thresholds indicate greater pain sensitivity. Based on pain pressure thresholds from our control group with intact limbs, we created an index of hypersensitivity, where data from participants with limb loss was compared to sex-specific control data on a Z-score scale. Pain pressure thresholds falling below the 25th percentile of sex-specific control data were considered hypersensitive, as seen in Figure 3. We then evaluated between-group differences in site hypersensitivity and generalized pain hypersensitivity, defined as hypersensitivity in at least one amputated region site and at least one secondary or unaffected site. We found participants with post-amputation pain to be significantly more sensitive to pressure-induced pain compared to pain-free peers with limb loss. Importantly, as seen in Table 1, we found an amputated region and generalized pain hypersensitivity to be more prevalent among adults with post-amputation pain who had a median of 2 hypersensitive sites throughout the body. Briefly, our findings suggest 50% of adults with post-amputation pain have amputated region hypersensitivity, which may reduce prosthetic comfort and use. Importantly, as over 40% of adults with post-amputation pain demonstrate generalized pain hypersensitivity, pain hypersensitivity may be a clinically useful marker for evaluating and tracking central nervous system hypersensitivity in post-amputation pain.